Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. It is a great pleasure for me to be with you today, just to elaborate and discuss for about one of the topics that threatening our life by 2050. And up to now, we have a disaster regarding the implementation of antimicrobial resistance in both sectors, whether it is the ecosystem, the human sector, and animal sector. Today's topic, we will discuss about how the animal production at a crossroads and facing the challenge of tackling antibiotic use and antimicrobial resistance. To start with that, we should understand the importance of the global importance of animal production. The animal production have several importances globally regarding the natural and food security. As we know that essential proteins, if from human, for human or from animals, it comes from the source of essential nutrition, comes from the animal production. So the essential amino acids and the micronutrients all are coming from the animal production. Also, 35% of the global food protein supply across global is come from livestock. Another aspect, the animal production is very important for food system resilience as a cornerstone of the food system and ensuring food security. The other importance of the animal production is the economic and social importance, as it is the source of livelihood and the income of several farmers. So billions of farmers are depending on the animal production. Also provides raw material and diverse activity through production. By 2050, the demand of the animal production, it will be more than double according to increased number of population worldwide. Also, the livestock contribute in nearly of 40% of total agriculture output in dependent country and 20% in developing ones, supporting the livelihood of at least 1.3 million people around the world, which is a big figure that the livestock and animal production will provide this number of people. And imagine after 10 years or 50 years, how much billions can be supported by the animal production. Also, the livestock consumed more than 10 billion tons of grasses and dry matters. These dry matters are not eatable by human, so we rely on the biodegradation and all these things on the livestock. Also, the pastoralists, who they are rearing the animal production and animal livestock, promote lands healthy by improving soil fertility, conservation of biodiversity, managing fires, and other aspects. So why we are using the antibiotics in the livestock? It is a big question. Livestock, same like humans, they are facing diseases, so they need to be treated. So the most use of the antibiotics or antimicrobial for the livestock system is for the treat of sick animals, and also as a prophylactic to prevent infection in animals. And also there is a common use of antibiotics, which is the growth promoters. For the growth promoters, it is for control the chronic disease in intensively reared animals and to improve feed utilization, production, and enhancement of economic return to farms. However, this term of growth promoter has been prohibited or banned by several countries all around the world, like the colistin, which is mainly used as a growth promoter for increasing the weight and increase the food utility in the animals. It has been banned by several countries, like in India and China in 2017 and 2019, and most recently it has been banned in UAE in 2024 as using as a growth promoter. So Now we are starting to saving our environments and ecosystem by banning several of growth promoters and antibiotics, which interfere with the treatment of human cases, same like the chloramphenicol and sulfonamides. All those groups of antibiotics have been banned by several countries worldwide. Whenever we mention the antibiotic and antibiotic treatment, there is another term comes immediately, which is the antimicrobial resistance or the AMR. The AMR, they used to name it as a global threat. Why it is global threat? Because whenever the animal or the bacteria develop kind of antimicrobial resistance, that means the antibiotic will not work against these infections. So at this stage, we will just say there is no any kind of intervention can treat the case of diseased animal or diseased human. It is a natural phenomena, but there are several triggers leading to the AMR. Also, AMR makes infection harder to treat, especially those people who are in the ICU. Several cases of ICU, before they are responding to the treatment with like tonsillitis. It is just short-term illnesses. But now, several cases in hospitalized people, they are not able to be treated due to salmonella, due to Pseudomonas or Staph aureus. However, previously, it is one of the common bacteria that can be treated easily. But because of the AMR, now we fail to provide this kind of training, of treatment, rather for animal or for human. The WHO has declared that AMR is one of the top 10 global public health threats facing humanity. Also, over 700,000 deaths annually due to antimicrobial resistance. So we can imagine this figure after 10 years if we didn't take an action to fight this phenomenon. According to WHO, this kind of statistic is for 2024. One child dies every 3 minutes for multi-drug resistance sepsis. 1.27 million deaths attributed to AMR per year. And you can see the impact of AMR. Also economically, more than 1 billion USA trillion for the healthcare, because long stay at the hospital may, because of AMR, lead to these economic losses. The AMR is not in human and animals, even in the environment. There are several reports from 72 countries all around the world reported that the threshold of antibiotics and antimicrobial 3 times threshold in the environment or the Atlantic oceans. Also, in the deep, dark forest, still the antimicrobial is there. Even in the clouds, they took samples from the cloud, the AMR is there. Even in areas, the plasmid-mediated antimicrobial is still transmitted from area to area, which increase the risk of AMR. So how much the pattern of antibiotic consumption in animals? 70% of global antibiotic used is in animals. Major use of antimicrobials, and here when I'm speaking about antimicrobials, meaning antimicrobials means antifungal, antiviral, antiparasitic. But here mainly we are speaking about the antibiotic, which is used for treatment of bacteria. So this number of tons of antibiotic also used by farm animals in 2020, but the question here, a huge amount of antimicrobial, is it prescribed as per the need, or it is just random use of antibiotic? We should ask ourselves these questions. Here in UAE, we have a different platforms to monitoring the antimicrobial use. As we are specialized in the field of antimicrobial, we realize that there is a huge consumption of antibiotic in animal in UAE. So by implementing and enforcing the vaccine campaign and wise prescription of antibiotic, we reached from 2019 to 2023 a reduction by 23% low number of antibiotic used in UAE. So how we can estimate the antibiotic consumption all around the world? Here we have the fingerprint of carbon fingerprint for like petrols, the use of carbons, the recycling. There is another term come in 2021, they name it antibiotic fingerprint. This is a new system launched by several countries, more than 27 countries, applied the antibiotic footprint to estimate the number of antibiotic consumption all around the world, whether it is African country or European countries. So the antibiotic fingerprint, it should be treated same as the carbon fingerprints of other chemical materials. Because at the end, it will lead to consequence of increasing this in human and animals, and also will harm the ecosystem in the future. The WHA, which is the World Organization of Animal Health, also implemented a new system in 2021 for estimation the number of consumed antibiotic in the animal sector. The new system, they name it as MUs, which is now implemented, and several entities in UAE have been trained to use this kind of platforms to estimate the consumption of antibiotic. Here are the several groups of antibiotic for animal use. We have more than 100 antibiotics, but these antibiotics is related to several classes or group of antibiotics. The bacteria can develop several resistant genes of these antibiotics by continuous or randomization use of this antibiotic. Here we held one study in 2019 among 182 E. coli samples isolated from animal from different type of samples. All this kind of resistant genes with significant number has been detected. That means there is intensive use of antibiotic in the animal setting leading to this kind of resistance. So an action should be taken. See, like 182 samples, 181 is resistant to sulfonamides. That means the E. coli should not be treated by sulfonamides as the resistance already developed. As we have the antibiotics, it is customized to treat the bacterial infection by several ways, by attacking the bacteria through different contacting sites, either by inhibition of the cell wall synthesis or by disrupting of cell membranes. So each antibiotic have sites of binding to treat the bacterial infection according to the classified number of antimicrobial. As an example, one of the antibiotics for disturbance of cell membranes of bacteria is the polymyxin. As we are designed antibiotics to kill the bacteria, also the bacteria prepared itself to compete this antibiotic and making treatment failure due to antimicrobial resistance by several aspects. So here are different mechanisms that bacteria can overcome the antibiotics by several mechanisms. One of the most important mechanisms is the plasmid, which is a free DNA, exists in several types of bacteria. This kind of plasmid can be transmitted from bacteria to others in the environments carrying kind of resistant genes. And this is one of the most uncommon mechanism comes due to gram-negative bacteria. Also, there is kind of mutation. Another thing, the random use of antibiotics may lead to what we name it the selectivity. Means that several antibiotics can lead to kill the beneficial bacteria, and lead to dominate of resistant bacteria, and this is case of mutation. Almost can be happened by several types of microorganisms. How the antimicrobial can spread between animal and human and environment. It can be transmitted through food chain, or through the manure and waste reinforced pathways and shared bacterial population. Also, globally, the AMR can be disseminated through the global trade, either by resistant bacteria cross borders via food or through international movement of animal and goods. So still we have several protocols that this AMR can be spread over countries and spread it among ecosystem, which include animal, humans, and environment. Here, as per the WHO, what's the driver of the AMR? The drivers of AMR, mainly the overprescription of antibiotics. Whenever I get sick, maybe it is a viral infection, so why should I apply antibiotic? So the overprescription of antibiotics is one of the triggers that lead to the AMR. Also, some patients not finishing their treatment, just 2 or 3 tablets, I'm okay, stop treatment. This is one of the most trigger for the AMR. Also, the overuse of antibiotic in livestock and fish farming, poor infection and sanitation, one of the triggers of the AMR. Also, the lack of new antibiotics being developed. Now, most of the antibiotics in the market, now they are overcome by the bacteria, and we need for new antibiotic to be invented, but unfortunately, the process is very long, and bacteria keep doing mutation to overcome these antibiotics. There is one study published recently, the new group of antibiotics which is invented, they find resistance to this new group of antibiotics. So imagine how the bacteria is clever to outcomes even the new antibiotics. And even the cost of these antibiotics is millions of dollars. And if we do not use these kinds of new antibiotics wisely, the outcomes, it will be the same result. Use and misuse of antibiotics. The misuse of antibiotics, the antibiotics is the important front lines for treatment of infection. If we are not using this kind of antibiotic wisely, the misuse will lead to disaster now and in 2050 as per the WHO. So practice contributing to misuse of antibiotics. Some antibiotics, as per the prescriptions, used of antibiotic without any clinical indication. There is no kind of clinical indication. But some people, they have this kind of mentality that whenever I take antibiotic, or if my animal, I want to protect my animal from getting sick, I can give antibiotics. And this is one of the triggers which lead to antibiotic AMR. Failure to use culture and antibiotic susceptibility test. Unfortunately, we need a robust system for the antimicrobial susceptibility test so that the selective antibiotics will be available for the treatment. But now, recently in the market, there are several protocols and platforms for launching or performing the antimicrobial susceptibility as rapid as possible. Also, the inappropriate specimen, some specimens can be collected to the lab without any kind of prescription or not in a proper way or proper temperature. Use of broad-spectrum antibiotics when it is not indicated, as the antibiotics are grouped into bactericidal and bacteriostatic. So bactericidal means it can kill the bacteria, and bacteriostatic, that means it can inhibit the metabolism of the bacteria. So whenever I need to apply any kind of antibiotics, I should see my preference, which kind of antibiotic. Is it the bactericidal or the bacteriostatic? Improper choice of empiric antibiotics, inappropriate route or dose and duration. All these kind of practices may lead to either the resistance, which we are facing now, the hypersensitivity, or the direct toxicity, or the super infection, which cannot be treated. So action to compete antimicrobial resistance. There are several ways to contribute to compete the AMR. One of the most important is the awareness. Awareness is the green light for competing the AMR. Because we did kind of study We name it the knowledge, the gap analysis among the farmers and owners. Unfortunately, we discovered that several of farmers, they do know that there is kind of AMR. And even they thought that the magic treatment of their animal is the antibiotic. It is more better than giving the vaccine. So immediately, whenever they have even a newborn, they can give the antibiotic. So acceleration research on new antibiotics and antibiotic alternatives, improve antibiotic use, enhance infection control measurement using sanitations, advanced development of rapid diagnostic tools. All this kind of tools can help in compete the antimicrobial resistance, but the most thing is the awareness. Also, this action can help in the competing of antibiotic resistance, and this should be distributed among the community to just understand the coming disaster and how their roles to compete this kind of disaster, like monitoring of antibiotic consumption. And now the international organization developed several tools for estimating the number of antibiotics for animals, and also joint risk analysis of AMR from One Health perspective. And I will show later several initiatives by ADAFSA in competing of the AMR. Also, they're kind of alternative to antibiotic, like the probiotics. It can be used for treatment of animal and human. Also, there is kind of coordination of global AMR action plan. As we know, the UAE have very strong AMR action plan for each 5 years. It includes different entities from academia, from food sector, human sector, and even animal sector. Antibiotic resistance, what the agriculture sector can do. Really, from this illustration, we did several of initiatives as ADAFSA to ensure that the antibiotic given to animal, including food producing and companion animals, are only used to control or treat infection. So even we increased the number of vaccination campaign for different animal diseases. Also, we implement international standard for responsible use of antibiotic as per the AMR action plan, UAE AMR action plan. One of the triggers that may help in combating the AMR is the implementation of the One Health. The One Health is a multi-sectorial and multidisciplinary approach connecting human health with animal health and environment. And it is one of the approaches that may help by a significant percentage in competing of the AMR, zoonotic disease, and several aspects related to disease, vector diseases, and several aspects can be handled per the One Health approach. It's connected between those three elements. And also, we should deal responsibly with the antibiotic. It is not my role, it is my role, your role. We should spread these kinds of awareness even among our children, that it is a big responsibility to keep our world safe from the antimicrobial by dissemination kind of awareness about the AMR. It is the responsible for all, for the farmers, the community, the physicians, the veterinarians, the nurses, even the teachers in the school should be involved in the awareness of AMR. Regarding ADAFSA initiatives, ADAFSA initiated one strategic project. It names Integrated Biosecurity System. This Integrated Biosecurity System have 8 initiatives. The pillar of these initiatives are all integrated, leading to improvement of biosafety management, risk management across the agri-food sectors, and also to enrich and leverage the human, animal, and ecosystem. These initiatives lead to several accomplishments. It leads to initiate of a new community named One Health Community. This One Health Community is led by ADAFSA. It contains more than 14 governmental entities, including the defense, the QCC for food, and ADAFSA as representative of agriculture, the police, the defense. It contains more than 14 governmental entities to implement the One Health approach through the One Health community. Also, it builds a new library. They names that it is a legislation library. It contains all the legislation internationally and nationally regarding the biosecurity and One Health. And also, it builds kind of network laboratories between human sectors and animal sectors for responding for the emergencies and crises. And also we have platforms for extending of reference materials and test processes regarding the One Health. Also, we build kind of collaboration with different entities. One of the collaboration is the One Health AMR Biosecurity Consortium. It contains more than 24 entities, governmental entities all around UAE. It's led by Khalifa University for doing a pilot study regarding the AMR between different sectors. And also, we initiate the One Health strategy plan for the prevention and control of antimicrobial resistance with different strategic objectives, all leading to fighting the AMR. Also, we did several kinds of awareness and brochures to enhance the awareness regarding the AMR. We emphasize the annual participation in the WOW Week, which is the World Antimicrobial Awareness Week. Also, we increase the number of campaigns regarding the vaccination for some of zoonotic diseases and several surveillance from One Health perspective ADAFSA participated in. And this awareness is also through different tools like live sessions, leaflets, radio, social networks. Also, we have a very strong communication with the Abu Dhabi Public Health Authority regarding the zoonotic disease, which is the disease can be transmitted from to the human from animals. So we have interconnection with the Abu Dhabi Public Health regarding the zoonotic disease. Also, we have several publications regarding the AMR in animals. ADAFSA has a big role in implementation of antimicrobial UAE AMR action plan as per the guidance of the WHA global strategy and as per the strategy of WHA for the antimicrobial resistance. Before I leave the stage, I need to convey this message for you that prevention is better than cure. It is a very important message. And whenever, if you are a veterinarian, physician, nurse, just think thoroughly before prescribing any kind of antibiotics, or if needed, just prescribe the right antibiotic for the right bug, not randomization. And thank you. I hope that I satisfy you by this presentation. Thank you so much.